Good afternoon. My name is Tracie Young, student nurse practitioner with Frontier Nursing University. The purpose of this presentation is to introduce to you the topic of increased prevalence of hypertension amongst African Americans when compared to other races. I'm going to pull up my PowerPoint presentation, share my screen. Okay, here we go. Many studies have been done recently which have established disparities in hypertension rates between the different population groups. Although hypertension is a leading cause of heart disease and leads to an increased risk of stroke for all individuals, the increased prevalence for African Americans is important to discuss and understand in order to help decrease the risks for this population group. Indicates several potential causes for higher rates of hypertension amongst members of the African American community, including genetics, diet, and culture. Approaches to help reduce the variances are being used, including the implementation of improved patient education, dietary recommendations, and encouraging lifestyle changes are a few of the approaches being used. Covering a genetic link to the disparities, researchers have found differing effects of hypertension medications for this population group. I selected this topic because hypertension runs in my own family, and I really wanted to explore the causes of this, as well as learn how to decrease my own chances of developing hypertension. This topic is important to discuss because approximately 30% of Americans have hypertension, and studies show it is more common in African Americans. A 2010 study found an 8.1% difference in the number of Caucasians with controlled hypertension compared with African Americans. The nutrition examination study found that among adults under age 65, the prevalence of hypertension was greater for African Americans compared with Mexican Americans and Caucasians. In researching this topic, I learned that there may be a pathophysiologic difference in African Americans, which may be the cause of the increased prevalence of hypertension for this population group. Have found differences in the urinary excretion of potassium, the renin-angiotensin system, testosterone sensitivity in African Americans, which may contribute to increased rates of hypertension. Dietary habits, excess salt intake, excess alcohol intake, obesity, and living a sedentary lifestyle are all factors in the risk for hypertension. Here, I would like to show you a short video about research conducted at the Coriell Institute in Camden on hypertension rates in African Americans. Pharmacotherapy reported that African Americans respond better when hypertension is treated with thiazide-like diuretics and calcium channel blockers as compared with beta blockers, ACE inhibitors, or ARBs. Quote, Medical Association 2014 U.S. hypertension guideline recommends in Blacks, including those with diabetes, that initial antihypertensive treatment should include a thiazide-type diuretic or calcium channel blocker, end quote. Lifestyle interventions. Modifiable health behaviors including, quote, limiting alcohol consumption, decreased sodium intake, smoking cessation, increased physical activity, and increased intake of fruit, vegetables, and whole grains may reduce incidence of hypertension and improve blood pressure control. According to a 2015 article in Current Hypertension Reports, quote, therapeutic lifestyle interventions are the bedrock of blood pressure control and overall cardiovascular risk reduction, regardless of race or ethnicity. Adverse lifestyles, including excess sodium, excess alcohol, obesity, and sedentary lifestyle, may be causal to hypertension in many patients and can also blunt the beneficial effects of drug therapy for hypertension. Outcome and goals. One of the goals for healthcare providers caring for patients with hypertension should be to focus patient teaching on these areas: smoking cessation, encouraging healthier eating habits, and increasing physical activity. According to the American Heart Association's website, www.heart.org, quote, heart disease is the #1 killer for all Americans, and stroke is a leading cause of death, but the risk is higher for African Americans. Preventing and curing hypertension can be achieved by learning about the disease and implementing steps to decrease the risks, end quote. Overall, the goal of the studies I researched seems to be to help address ways to decrease or eliminate the disparity rates. The Million Hearts Initiative is a program designed to prevent 1 million heart attacks and strokes over 5 years and reduce the disparities and the risks of cardiovascular disease. Enjoyed this presentation. I will definitely take the information I have learned during this project with me as I prepare to take care of patients in this population group once I become a nurse practitioner. Thank you.